Dr. Nandita Mohan and welcome to Medical Dialogues, your daily dose of health and medical news. Here are the latest developments in the world of medicine. Good cardiovascular health is considered critical for prevention of type 2 diabetes regardless of genetics. Type 2 diabetes mellitus is a very common chronic condition characterized by impaired glucose and insulin metabolism. About 463 million are said to be affected by this, which is expected to increase to even 700 million by 2045. Multi-level intervention measures are warranted to improve, but its prevention, as its pathogenesis is driven by various genetic and non-genetic factors. One such preventive strategy adopted in a study published in the European Journal of Preventive Cardiology is that favorable cardiovascular health can prevent type 2 diabetes in middle-aged people regardless of their genetic susceptibility. The researchers calculated the cardiovascular health score by including parameters like body mass index, blood pressure, total cholesterol, smoking status, diet, and even physical activity. It was found that adults aged 55 with higher genetic risk for type 2 diabetes but ideal cardiovascular health only had 22.6% remaining lifetime risk for type 2 diabetes, while those with intermediate condition had 28.3% risk and lower cardiovascular health had only 32.6%. To conclude, the study observed that adhering to a favorable cardiovascular health in midlife could lower the remaining lifetime risk for incidence of type 2 diabetes. Doctors remove 4 inches piece of cement from heart, an NEJM case report. We have come across previous researches where doctors are found retrieving objects from humans while on the operating table. One recent case report that has come into limelight is when a 4-inch piece of cement was removed from the heart of a man. It is believed that the piece had leaked into his body from a previous spinal surgery. According to the history, a 56-year-old man with a recent vertebral compression fracture presented with a 2-day history of breathlessness and chest pain. 1 week earlier, the patient had undergone L5 kyphoplasty with polymethyl methacrylate medicine cement. 5 days later, he had sudden onset of pleurotic chest pain on the right side with radiation to the jaw and shoulder. On radiographic and CT examination, an intracardiac foreign object was observed. The patient underwent emergency cardiothoracic surgery. During the procedure, a foreign body was found to be perforating the right atrium, crossing the pericardium into the pleural space and puncturing the right lung. Cement embolism is a known complication of vertebroplasty in which polymethyl methacrylate leaks into the venous system through the iliolumbar or epidural veins. The rate of complications due to the cement leakage may vary from 1 to 10%, with cement extravasation into the venous system in 24% of patients. Emboli may further migrate into the right heart chambers and pulmonary arteries. Patients may vary in presentation from asymptomatic or symptoms such as syncope to even life-threatening complications. Therefore, the management protocols need to be hastened based on individual clinical circumstances. Diet drinks may increase the craving for food, thereby preventing weight loss efforts in obese individuals. Obesity is one of the major concerns in recent times. In a study, it was seen that females with obesity may be more susceptible to responsiveness than has been evoked by sucralose ingestion. Non-nutritive sweeteners are used in place of nutritive sweeteners to satisfy the sweet cravings while lowering the calorie consumption. But interestingly, a recent research has quoted that consumption of diet drinks may thwart the weight loss initiatives. It also mentioned that those containing this artificial sweetener may even increase the food cravings and appetite in obese women. For the study, plasma glucose, insulin, glucagon-like peptide, acylrenin, total peptide, and leptin were measured in blood samples that were taken at baseline, 10, 35, and even 120 minutes after participants drank a drink containing either sucralose, sucrose, or even water. The study suggested that young female participants had a higher sensitivity to nutrition sensing, which developed as a reproductive protection strategy. Hence, non-nutritive sweeteners for body weight management can be useful. Gas-related intestinal symptoms are frequent and tied to physiological distress and poor quality of life. With an increase of work from home culture, a sedentary lifestyle is slowly coming into existence, and so are the health problems that are linked to it. According to a new survey being presented today at the UEG Week Virtual 2021, gas-related symptoms are associated with poor quality of life and higher stress, anxiety, and depression, with breaking wind being the most frequently reported gas issue, affecting 81.3% adults in the general population in a 24-hour period. The survey revealed that higher ICQ scores correlated with lower mental health and quality of life score, higher stress, anxiety, and depression, and more non-gastrointestinal symptoms. Younger people aged 18 to 34 and 35 to 49 had the highest overall burden of gas-related symptoms. Hence, they concluded that having a very high amount of these common intestinal symptoms is associated with higher levels of depression, anxiety, and stress, as well as an impaired general quality of life. Laparoscopy superior to laparotomy for managing ruptured tubal ectopic pregnancy. Ectopic pregnancy is one of the most emerging conditions during the pregnancy period, in which the fertilized egg is implanted outside the uterine cavity. The occurrence of ectopic pregnancy accounts for approximately 2% of the total pregnancy worldwide, whereas in India the incidence is 3.5 to 7.1% and is a major cause of pregnancy loss. Laparoscopy and laparotomy both are established in gynecology for several years. In the developed countries, laparoscopy is widely used for management of ruptured ectopic pregnancy because of the availability of skilled manpower, logistics, improved anesthesia and cardiovascular monitoring, well-organized surgical care, and good healthcare insurance. For ruptured tubal ectopic pregnancy management, laparoscopic procedures are implemented with an aim to reduce intraoperative blood loss, analgesic requirements, hospital stay, and higher recovery, as well as its effectiveness in patients with massive hemoperitoneum. However, laparotomy is still preferred surgery in low-resource setups. A clinical retrospective study included a total of 90 confirmed cases of ruptured tubal ectopic pregnancies, which were divided into two groups, 68 in the laparoscopy group while 22 were divided in the laparotomy group. The main outcome measure included demographic features like age, parity, previous spontaneous loss, previous MTP, hemoglobin at admission, period of gestation, total blood loss and hemoperitoneum, and post-operative parameters, blood loss, blood requirement, and duration of hospital stay. The results showed that laparoscopic approach for the management of ectopic pregnancy has largely replaced laparotomy. In the present study, ruptured tubal ectopic pregnancy was managed with laparoscopic approach in 75.5% cases. All the ruptured tubal ectopic pregnancy cases were taken for emergency operative procedures, either laparoscopy or laparotomy. In the laparoscopic group, hemoperitoneum with estimated blood loss was observed in 68% patients and was successfully operated with laparoscopic procedure. Therefore, it was concluded that laparoscopic procedure is not only safe for early ectopic pregnancy but also appropriate for tubal rupture with hemoperitoneum. That's all for today from the medical world.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.